Your back affects your daily health. Welcome to another installment of Your Spine, Your Health.
Welcome to Your Spine. I'm Dr. Don, and this is all about your spine, your health. Our job here is to bring to your attention the segment we're talking about today, which simply is C7. Now, C7 is the last of 7 vertebrae in our neck that generally calls the cervical spine. C7 is connected, of course, to the one above we called C6. And now at C7, we transition to another part which we'll talk about next week. However, the vertebrae is known as the first dorsal or first thoracic vertebrae. So C6, C7, T1 is a continuation of the neck, the 3-joint complex. Things that go on around C7, however, are commonly starting to find their way as effects going across the shoulders. So some of the pains that you get around the 7th cervical vertebrae in association to the ones above and below are now going to feel for some people as muscle pains. There'll be movement issues where movement to one direction hurts and can't go as far as the opposite. These are some of the simple clues to you that a problem may be existing around that part of your spine. But a curious thing happens here. People start to complain about shoulder problems. Well, there's a difference between a shoulder problem that happens from a fall or an injury, or you're on a ladder and you happen to hang by one arm. Sure, that's an injury right in the shoulder. That's separate from the pain that you may feel in a shoulder, but when you try removing your neck, you still get that pain shooting right back to the neck. So the important thing to understand is a problem in the shoulder may not be coming only just in that joint. If you find that this problem continues and you're only treating the shoulder, it can lead to a later syndrome that is often called frozen shoulder. It's really easy to see a person who has frozen shoulder because instead of lifting their arm, they lift their whole body. These conditions need to be carefully looked at to understand whether the problem is truly coming only from the shoulder joint and/or has a relationship from C7 or slightly lower. Shoulder problems, wrist problems have to be separated to identify if there's been an injury there or if you're still experiencing a problem from the area of C7 affecting the muscle and nerve tissue. Spine problems like this, they will occur from poor posture. Last week we talked about the posture of text neck. Very simply, you're over like this far too long. Posture, repetitive in social activities, work habits, or other activities needs to be broken up with stretching exercise. Remember, each show we try to remind you and demonstrate that not only do you have vertebrae, which are important to your body structure and movement, but their well-being is not exclusive to just having strong muscles. Remember, it's about stretching movement, all 24 vertebrae. These conditions can start at any age, sports when you're young, repetitive work habits when you're in your work years, or postural problems that you may encounter as we age. Remember, your back is important to your daily health. Join me on the next show as we continue our journey down your spine.